Hello there, you're watching Debrief on CNN News 18. I'm Maha Siddiqui. India is still dealing with the brunt of the COVID-19 pandemic like the rest of the world. But amidst this, there are more healthcare concerns from the north to the south of the country. Hundreds of children have been impacted in Uttar Pradesh by dengue in what was so far being called a mystery fever. A child in Kerala has died due to Nipah virus. The onslaught of the viral illnesses continue unabated. Why is this happening? What preventive steps can you take? All this over the next half an hour, India's public health SOS. Let's start with the south first. There was some relief today for Kerala as the high-risk contacts of the Nipah patient tested negative. But several more are under observation and the state is keeping its fingers crossed even as it is doing a meticulous contact tracing process. Neetu Regukumar helps us understand the arduous task of keeping people safe, both from COVID and Nipah.
It's a sigh of relief for Kerala as 8 samples of high-risk contacts have tested negative for Nipah. These include the 12-year-old boy's parents and health workers who interacted with him. The contact list of the child has about 251 primary and secondary contacts. Out of them, 54 are in the high-risk category.
All the 8 samples, total 24 samples of 8 persons sent to NRV Pune were tested and all the samples were found negative. And we are testing more samples. Already a lab is set at MCH Kozhikode and they have started testing.
With the panchayat in complete lockdown, the health department has begun door-to-door surveillance, where they're looking for anyone with symptoms and then cross-checking if they had any kind of contact with the affected case. They're also checking if there are bats in their premises or if they've had a history of eating bitten fruit or have had contact with pigs, the 3 primary forms of transmission of the virus. All districts have been asked to be cautious and follow the Nipah management plan. Health experts say that although the state has managed to pick up the Nipah virus at the beginning stages of the outbreak itself and has contained it very well, the current episode is a matter of concern.
If you look at the history of Nipah, the last 3 outbreaks is from Kerala. That is really a matter of concern for us. So we have got the ability to pick it up even during the outbreak itself. If you look at the history of Nipah, you will see that it is very rarely these outbreaks were picked up during the outbreak itself. So that is something very good. Why the recurrent episodes of Nipah is happening in Kerala and how we can prevent it, that is a real matter of concern.
Experts believe that healthcare workers can breathe a sigh of relief as they have already been following COVID protocols and are masked and wearing face shields or PPE kits. But with its high mortality, Nipah still is nothing to sneeze at.
Nipah is creating some kind of a clinical picture of coughing, sneezing and all other kind of respiratory symptoms. Because this respiratory symptom, all other people who are in the vicinity can be affected by Nipah. So the killing power of the Nipah has increased when it is moving from Malaysia to Bangladesh or even in Kerala. But we are seeing that during this year, the killing power of Nipah has much increased.
The State Animal Husbandry Department has collected samples of the Rambutan fruit, bat droppings and samples from the goats in the house of the child. They are also collecting blood samples of goats within a 1-kilometer radius of the child's house. All samples will be sent to a lab in Bhopal. The health department says there is no need to panic and also advises people to eat fruits only after thoroughly washing them, not to eat any kinds of fruits that are bitten, and also not feed bitten fruits to their domestic animals. Already reeling from COVID, Nipah is going to be the Kerala model's biggest test. With Neetu Regukumar in Thiruvananthapuram, Natasha Menden for CNN News 18.
Well, the mystery around how the 12-year-old got the Nipah virus is still under investigation. But here's the fruit that's under the scanner, the Rambutan. So what is it and what role did it play in Nipah infection to the child, if at all it did play a role? So here's the fruit. That's the fruit for you on your screens now. And what is it? It derives, first of all, its name from a Malay word Rambut, which is hairy. And why is this word hairy used here? Because the outer case of the Rambutan has spikes spike-like things, which is like a hairy fruit, hard shell outside and a soft fruit inside. That's there for you on your screens now. Its a reddish appearance often makes it look like a lychee, and it does taste slightly like that as well, but less sweet than the lychee itself. Meanwhile, the plant originally is from Southeast Asia, so it doesn't have a very long history of being in India. It's only in the last 2 decades that this plant really was seen in the country, and they started cultivating it in Kerala about 2 decades ago, that is about 20 years ago. And it's not just in Kerala, it's grown in other parts of the country as well now, in Maharashtra and in Tamil Nadu as well. This is the fruit, Rambutan, that is now under the scanner. Did the child eat the fruit that was bitten by a fruit bat? That is being suspected now. Meanwhile, possibly infected after having been bitten by bats. That's what I was pointing out. This is a fruit bat usually that transmits the Nipah virus. So it is being assumed right now, and it's still under investigation, as I'm pointing out, that a bat could have either bitten into the fruit or the droppings of the bat could also be one of the reasons. Samples from Kozhikode sent to NIV for analysis, a sample from where this infection has now been reported. Meanwhile, while Kerala is dealing with Nipah from south to the north now, a so-called mystery fever has been taking children in its grip in Uttar Pradesh for the last couple of weeks. This is no mystery fever though, it's dengue, resulting in a serious fallout for children. Many have had to go on oxygen support. 50 deaths have been reported so far, out of which there are 40 children. It was being reported initially from western Uttar Pradesh, but cases are now emerging from eastern UP as well. Our Uttar Pradesh Bureau Chief Pranshu Mishra gets us a roundup of the state firefighting the dengue crisis now amidst the COVID pandemic.
There's a new virus on the prowl, and children are its main casualty. Western Uttar Pradesh is seeing a huge spike in dengue cases, reporting over 100 in the past 2 weeks, a majority of them children. Firozabad is the worst affected district with over 51 deaths so far, 40 of them children. The current illness plaguing UP is a severe form of the dengue virus, causing several dengue hemorrhagic fever deaths.
मुख्यमंत्री जी ने भी निर्देश दिए थे, उसके हिसाब से हो गया है 50 और 15 65 बेड लग गए हैं, और ऊपर वाले फ्लोर में अभी ज़रूरत पड़ेगी तो और बेड लगाए जाएंगे। तो हमारा प्रयास ये है कि किसी भी मरीज़ को वापस ना जाना पड़े, और हम लोग सबकी जितना यथासंभव हमारी सेवा हम लोग कर सकते करेंगे।
The viral menace is also now spreading to eastern parts of the state. Balia saw a 25% increase in viral fever cases in the past 10 days. In Prayagraj, over 170 people were admitted to the hospital, most of them requiring oxygen support. According to the World Health Organization, the dengue virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti. Its common symptoms are joint pains, headaches, dehydration, nausea, and in some cases rashes. The rise in dengue cases is likely due to the rains and flooding that UP saw last week. Last week, UP CM Yogi Adityanath visited hospitals to take stock of the situation. Now the Chief Minister has directed a team of specialists to oversee the treatment and training plan. The Firozabad administration has come up with an innovative solution to tackle this menace. The administration has introduced the gambusia fish, commonly known as mosquito fish, into ponds and waterlogged bodies. These fish, ordered from Badaun, eat the larvae of the dengue breeding mosquito, helping curb the spread.
जहाँ भी जल भराव हो रहा है, छोटे छोटे तालाब गड्ढे हैं, उनमें गंबूसिया मछली डाली जाए ताकि वहाँ मच्छर जो लार्वी पैदा कर रहा है उसका निपटारा हमारी गंबूसिया मछली कर सके और हम लोग डेंगू के जैसे वायरल से बच सकें।
But UP's troubles don't end there. A few cases of malaria and scrub typhus have also been detected in the state. Scrub typhus is typically spread through the bites of the infected chiggers or larval mites. The UP administration will now have to work fast to bring this disease under control, because if the third wave hits, it will spell doom for UP's health infrastructure.
Alarmed by the high number of deaths, Centre 2 has intervened. Not only a team of expert doctors was sent to Firozabad, the state government has now also been advised to go in for large-scale testing and intense sanitization drive to curb the further spread of infection. Pranshu Mishra in Lucknow for CNN News 18.
Dr. Ishwar Glada, consultant in HIV and infectious diseases and Secretary General Organized Medicine Academic Guild, is joining us here on the show. Dr. Glada, many thanks for speaking with us. First of all, sir, why was there confusion in the initial days about dengue in Uttar Pradesh? Is it so hard to identify and segregate this disease? And doesn't identifying the illness correctly help in mounting a cure faster?
There is a saying in medicine which says, eyes do not know what the mind does not, mind does not think what I do not know. So if you do not know what is the infection like, if you are not suspected, then basically you are not going to do the test. Unless until you do the test, you will not find out. And a lot of symptoms are similar to malaria, similar to many other infections. Therefore, they go unnoticed. Only after a lot of deaths, then they realize that why so many people are dying, then they realize. In the dengue, platelet count goes down. So that is one of the most important tests which should have been done. Dengue antibody tests are done, NS1 antigen is done. So if you do antigen test, antibody test and common blood test, which is called complete blood count, CBC, in that platelet count is lower, that tells you that it is dengue.
Dr. Glada, is this form of dengue that we are seeing in UP any different from the usual?
I don't think it is different from usual, but only thing unusual is so many people dying. Usually in dengue, so many people do not die. So, and there is no perfect treatment for dengue. There is no vaccine for dengue. We need to just control fever. And for fever, paracetamol is available everywhere. Only when the platelet count goes down below 50,000, we get concern, and below 10,000, there is a problem that they could have hemorrhagic fever and they could have hemorrhage and they could have a lot of complications. At that time, we may give platelet or blood transfusion.
That's right. All right, Dr. Glada is going to stay with us because we are in the midst of a pandemic, and the spread of viral illnesses rearing their ugly head even as the world continues to grapple with the novel coronavirus or COVID-19 is of concern right now. The Maharashtra administration is warning that we have hit the third wave. This even as people are out on the streets again in large numbers due to the festive season starting. Vinaya Deshpande does a status check of Maharashtra's COVID crisis.
Local trains have started, people have started thronging markets. Ganeshotsav is just round the corner. We are at Dadar station to show you how a local train station looks like at a time when Maharashtra fears the third wave of COVID.
Maharashtra has been reporting 3,500 to 4,500 cases on a daily basis. Though 7 crore people have already been jabbed, the government still has miles to go. Meanwhile, Nagpur Guardian Minister Nitin Raut has already announced that the third wave has hit Nagpur. The region reported 14 cases yesterday, but what's causing concern is that most of the cases are among the fully vaccinated. A view echoed by the mayor of Mumbai herself.
जो आंकड़े कोरोना पॉजिटिव के हमारे सामने आए वो बहुत दिनों बाद आज डबल के फिगर में हम आ गए हैं. इसका मतलब हमारे यहाँ थर्ड वेव का आगमन हो गया है.
But people are in no mood to curb the celebrations. Train after train carrying Konkanis leaving Mumbai to go to their native coastal villages for Ganeshotsav. Politicians cash in on the opportunity to earn some brownie points.
गणपति फेस्टिवल के लिए जा रहे हैं हमारे गांव और हमें ये सोई सुविधा उपलब्ध करके दिया. हमें बहुत आनंद हो रहा है. ट्रैवलिंग हमें अभी मतलब उतना पॉसिबल नहीं हो सकता था, पर ये ट्रेन से हम अच्छे से जा सकते हैं. गणपति बप्पा मंगल मूर्ति.
Marketplaces are buzzing with activities. Forget restrictions. This time the sentiment is to have double the celebration given the muted festivities last year.
This year everything is like the double. The spirit is double. I think the Ganpati ka size and the quantity is going to be double because everybody is celebrating in a big way now.
Mumbai has been reporting over 300 cases every day. Not that it's noticeable on the streets.
चल रहा अच्छा चल रहा है सब जो भी है पालन कर रहे हैं अपना जो है सब ठीक से चल रहा है कोई दिक्कत नहीं उनकी कृपा रहेगी तो सब अच्छा ही होएगा ना अभी अच्छा ही हो रहा है धीरे धीरे सब
The government will impose stricter rules if oxygen consumption in the state goes above 700 metric ton.
सर्वच गणेश भक्त निश्चित प्रकारे खूप
There is a lot of excitement about Ganesh Chaturthi and there should be, but it is my appeal to people to follow COVID protocols.
कोविडच्या पार्श्वभूमीवर
Colors, sounds and smells of Ganesh Chaturthi have already filled the streets of Mumbai. People feel that the spirit of the festival should not be dampened by COVID. On one hand, the government feels that Maharashtra stands at the cusp of the third wave. On the other hand, people are seen roaming around on the streets without following any COVID protocols or restrictions. With video journalist Manish Dubey, this is Vinaya Deshpande from Mumbai.
Dr. Ishwar Gilada is still with us. Dr. Gilada, even though we're seeing breakthrough cases happening in Maharashtra of people fully vaccinated getting COVID, can we though be sure that these cases, and most of them, will not need hospitalization?
See, we should divide Maharashtra into different parts. Maharashtra is a large state. Currently, last 1.5 months, there are 8 or 9 districts of concern, out of which 3 from Konkan, that is Raigad, Ratnagiri and Sindhudurg. They are currently out of that districts of concern. But there are 5 districts like Ahmedpur, Ahmednagar, Pune, Sangli, Satara, Kolhapur is out, and Solapur. So Ahmednagar has been told by even Prime Minister or Chief Minister as a model district. I don't know what is a model district. Last 2 months, Ahmednagar cases are 500, 600, 700, up to 1,000. And Ahmednagar's population is 1/3 or 1/4 of Mumbai district. So I think if you segregate these 8-9 districts and rest of Maharashtra, the difference is 1:600. At one place in one day, one case, in other place there are 600 cases. And if you look at per lakh population, I think these 6 or 7 districts are districts of concern. But what you are showing now, that on one hand we would like to control COVID, on the other hand we are running COVID express trains. There are 64 trains by Western Railway, 120 trains by Central Railway, 2,000 buses by Maharashtra government. So I don't know whether we want to control COVID or we want to spread COVID. And this has happened last year also. Yes. Last year also, after the Ganesh festival, a lot of people went to Konkan, and then Konkan was highly endemic for the COVID.
Okay. Well, Dr. Gilada, many thanks for sharing those details with us. Certainly, the administration needs to take a note of the points that are being made by doctors there about the movement of people, even as we continue to be in the midst of a pandemic. Taking a very quick break now. When we come back, here the expert, Dr. Gagandeep Kang, will help allay some fears in this phase of anxiety. Welcome back. Virologist Dr. Gagandeep Kang says that the third wave is unlikely to be as devastating as the second. For the time being, she also rules out any immediate need for a booster vaccine in India. Listen in.
Statistical models that suggest that we could be in the midst of a third wave by October. There are people like Dr. Mulyal who never minces his words, saying that the third wave is a figment of someone's imagination. So how should we read where we are today?
I think if we don't have new variants, the chances of a third wave that resembles the second wave is extremely unlikely. And that really is because the bulk of the population has been either infected or vaccinated. The models are conjectures, and quite frankly, for many of the conjectures that are predicting a third wave, I really don't know where they are getting their input data from. Having studied infectious diseases for quite a while, I know that prior infections or vaccination confer protection. And the more the population that is previously infected or vaccinated, the greater the chances that you will have less disease.
When we hear the WHO saying that it's perhaps endemic, how do we read that?
when the WHO or anyone else says that this is a disease that is endemic, it means it is a disease that is widely prevalent in the population. It's not a disease that's going to go away. You may not see it today, you may not see it tomorrow, but you will see it occasionally in flare-ups or as sporadic cases that are detected wherever testing is done. We have to learn to recognize that this is a disease that's going to be with us for a while. And most of the infectious diseases that we have are endemic. Tuberculosis is endemic. Cholera in India, even though it causes outbreaks, is an endemic disease. Rotavirus is endemic. Influenza causes, again, a pattern of disease, but is actually an endemic infection.
Given the fact that we have such a high seroprevalence, does India need to consider a booster?
I don't think this is the time for a booster for India. I think we should wait and watch. We are actually in a very fortunate position because of the difficult time we went through with the second wave. Having a national seroprevalence of about 2/3, even before vaccine coverage became really high, gives us a distinct advantage that other parts of the world have not had. You know, we saw Delta first, we encountered the worst of Delta first. And that has left us with a high level of seropositivity, which I think is very likely to provide us with a high level of protection, both against severe disease and mortality, as well as some level of protection against transmission.
And even though Dr. Gagandeep Kang may have helped ease some anxiety, don't forget to continue to take care. Wash your hands, keep a distance, mask up, and don't let water be a breeding place for mosquitoes. Stay healthy, stay with us. Bye-bye. See you tomorrow.